The medicine of the week is a group of medicines known as low molecular weight heparins. The group low molecular weight heparins includes dalteparin, nadroparin, enoxaparin, and tinzaparin. These are not the only low molecular weight heparins out there, but are the ones approved for use on the Dutch market. They are derived from heparin, a naturally occurring polysaccharide that consists of molecular chains of varying lengths and molecular weights, between 3 to 30 kilodaltons. Low molecular weight heparins are obtained through depolymerization or fractioning of heparin and have a mean molecular weight of around 5 kilodaltons. Heparin is an anticoagulant that works by binding antithrombin. Subsequently, this complex binds coagulation factor 10A, which is responsible for the activation of prothrombin to thrombin. This decrease in circulating factor 10A will lead to a lower formation of thrombin, which converts fibrinogen to fibrin. Lower thrombin will therefore lead to lower fibrin, and thus less clot formation. Longer molecular chains in unfractioned heparin can also bind thrombin itself, leading to a less predictable anticoagulant effect. Because low molecular weight heparins only contain the shorter chains, they only bind antithrombin. Their anticoagulant effect is therefore much more predictable than heparin. The anticoagulant effect can be assessed by measuring the anti-10A levels. Low molecular weight heparins are primarily used for the treatment of venous thromboembolic events, such as deep venous thrombosis or pulmonary embolism, as well as for the prevention of these venous thromboembolic events in patients at high risk. This includes immobilized patients, patients with cancer, and patients after major surgery or orthopedic surgery. Low molecular weight heparins are also used in the early treatment of acute coronary syndromes, which are arterial rather than venous thromboembolic events. Low molecular weight heparins are administered by injection into the subcutaneous fatty tissue of either the abdomen or upper legs, usually once a day. Occasionally, when there's a high risk of bleeding, or when there is a high risk that emergency surgery may be necessary, the daily dose may be divided over 2 doses instead. Administration of low molecular weight heparins can be taught to patients or caregivers so that patients can be treated in an outpatient setting. However, nowadays there are oral alternatives for most patients. There is a group of medicines known as direct oral anticoagulants, or DOACs, that encompasses medicines such as apixaban or edoxaban. These medicines come in tablets that also have the same mode of action as low molecular weight heparins, which is inhibiting coagulation by neutralizing factor 10A. The dose of most low molecular weight heparins is expressed in international units. The only exception to this is enoxaparin, of which the dose is expressed in milligrams. 1 unit of low molecular weight heparin is the amount of the medicine required to keep 1 milliliter of blood liquid for 24 hours at 0 degrees Celsius. When prescribing low molecular weight heparins, it is important to dose using the international units rather than milliliters, since different formulations with different concentrations exist. For instance, there is nadroparin with 9,500 units per milliliter of fluid, and there is nadroparin with 19,000 units per milliliter of fluid. If nadroparin 0.6 milliliters is prescribed, without a clear indication of which formulation to use, the patient could be either underdosed or overdosed. Low molecular weight heparins are dosed based on the patient's body weight. In obese patients, the lean body weight is used rather than the measured body weight. Kidney function is another special consideration with regards to dosing, since most low molecular weight heparins are primarily eliminated via the kidney. Decreased kidney function could therefore lead to accumulation. In obese patients and patients with decreased renal function, dosing should be guided by measuring anti-10A levels. As with other anticoagulants, bleeding complications are the most important side effect of treatment with low molecular weight heparins. Administration site pain and hematoma are the most frequent complications. And another important side effect is heparin-induced thrombocytopenia, which is an immune-mediated condition caused by heparin and its derivatives through formation of antibodies aimed against platelets. The chance of this severe side effect is much lower than in case of use of unfractioned heparin. In summary, low molecular weight heparins is a group of anticoagulant medicines that are obtained by fractioning or depolymerizing naturally occurring heparin. Low molecular weight heparins bind antithrombin, with the complex subsequently binding coagulation factor 10A, thus leading to less fibrin formation. Dosing is based on body weight. Kidney function should also be taken into account when dosing, since accumulation may occur. Anti-10A levels can be used to confirm dosing accuracy. Although low molecular weight heparins can be used in outpatient setting, there are oral alternatives in the form of the DOACs.